Yes.
Yes. Okay, perfect. Thank you very much. I'm very pleased to present about care work in the IDWF in this meeting with the IDWF and to brief the staff and the steering committee about what we have done in the big report on the care economy that most of you knows. We kept this template on purpose from the Gender Academy because the report was so well received that we were asked to design a course on the care economy and on care work based on the report. But anyway, I have tailored the presentation for this meeting. So it's not actually the same presentation for the course because I know that most of you already know a lot about care work. So at first, I think we need to see what is care work. So I have prepared a series of pictures regarding care works. For instance, on this first picture is a father with children. Then we have a father that is playing with the kid at home. We have a woman doing the laundry, and we have two women that are playing with a younger child. On the other part of the slide, pictures regarding a teacher or another teacher teaching in school, domestic workers, probably cleaning an office, and healthcare worker are appearing. So these are actually two separate parts of care work. So unpaid care work on the left and paid care work on the right. And this is very important to differentiate between the two. But we will see that these two are very well connected. Now, let's see. What is care work? So care work is direct personal care that is provided, and also indirect care activities, such as housework. Care work can be provided for pay, and this is paid care work for a monetary reward, or can be unpaid. So there are two important statistical definitions that recognized unpaid care work as work. One is the 2013 ICLS, and the second one is the 2018 resolution. Why is important? Because this last resolution actually will prompt National Statistics Office to collect statistics on unpaid care work, to give light to unpaid care work and on the conditions that under which unpaid care work is carried. Then, who are those who carry out paid care work? So these are care workers. Care workers can be employed in the health and social work sectors, in education, but care workers can also be employed in other sectors, such as in a doctor working in international organization. But last but not least, we have domestic workers. Domestic workers in the care report are actually defined as those who, basically those employed by household. To be statistically sound, those that are found in ISIC 97, so in the industrial classification of activities, of industrial activities. But to have a more in-depth or a thought on how we define domestic worker, I would like to briefly ask Claire to jump in and give the difference between the statistical definition of domestic workers and the one in Convention 189. Claire?
Yes, thank you very much. So indeed, you know, when we do the reports and we want to count the number of people in a sector, we need to use these international statistical definitions. And sometimes these statistical definitions are not aligned with legal definitions. They try to be, but sometimes it doesn't quite fit. And then there's two levels of law. There's the national laws, and then there's the international laws. And then again, the same with statistics, which you may or may not know. There's an international classification, and then there are variations between how different countries count different groups. So all of this can make everything sound a little bit complicated, and when the ILO publishes its reports, we need to make some decisions to be able to say, who will be counted and who will not be counted. So for care workers, as Umberto pointed out, it was clear that we were going to be counting care workers in health and social work and in education, and non-care workers in health and social work and in education, as well as care workers in other sectors. So as he said, for example, that would be a doctor or a nurse who works in, for example, in our office at the ILO, we have some nurses and doctors who are there in case the staff gets sick. So that would be a care worker who's working in another sector. And then for domestic workers, the statistical problems that we have had, and we still sort of have, is that if we look at national surveys, the only domestic workers who are counted really, who are visible, are those who are working directly for a household. So that means that if somebody is doing domestic work, but who's employed by a company, we don't see them in the statistics. So that means that the number of domestic workers that we publish is always an underestimate, and for many other reasons as well. The other issue that we have is that because domestic workers are providing a particular kind of care work in private households, that doesn't mean that there aren't other care workers who are providing the same services. So let me try to explain that in some countries, the care services in a private household are provided by somebody who's employed by a public agency or an enterprise, and that person might be defined as a care worker in the statistics, even though they're providing that service in a private household. So for the ILO Convention on Domestic Work covers any work that's performed in or for a household. And the most important part is that the workplace is the household. So the convention doesn't care if the employer is a company or if it's a public sector or if the employer is the household. The important thing is that the Domestic Workers Convention will be there to protect you if you are working in a private household. So, it basically means that a domestic worker, in this definition of paid care work, domestic workers are care workers, but statistically sometimes you see them appear listed as a domestic worker and sometimes you see them listed as a care worker. And then of course, so if there's the international legal definition of domestic work in C189, that still may or may not be in line with national definitions, as you know. So a domestic worker at the national level has a particular legal definition, and care workers are often covered by other laws. And often what that means is that domestic workers are covered by or not covered by laws, whereas other care workers are covered by the laws. So this is why in the Care Work and Care Jobs report, we also wanted to make sure that all of those care workers, including domestic workers, were included so that we could show how differently domestic workers and other care workers are covered by the law. And that is something that comes later on in the report. Umberto, was there anything else that I was supposed to say that I forgot?
No, I think it was very clear, and I think that it was very important to mark this statistical, the difference between the statistical definition and the legal definition, because as you said, Claire, in statistics often we have limitation, but this is also not an excuse for not coming up with estimates that are important and then can give some very important information for policies. Then now we have an entire report on the care economy, but why the care economy is important? Well, the first to answer in very few words, so the demand for care work is rising. this means that there will be in the future more demand for care work, and this is due to global transformation. There are actually two trends: aging population in certain countries, and also increasing care demand from children. And if these deficits are not adequately addressed, so the deficit between the availability of care work and care workers and the demand for care work, there will be a global care crisis. Just to give you a few numbers, in 2015 across the world there were 2.1 billion people in need of care, 1.9 billion were children under the age of 15, and 0.2 billion were older persons that are defined as those aged at the healthy life expectancy or at 60 years of age or above. So those who really need some forms of long-term care. And by 2030, there will be an additional 200 million people in need of care, including 100 million older persons. So those really, the older person and those who are frail and who really need care. So why there can be a global care crisis by 2030 if these issues are not properly addressed? Well, what we have seen in the report is that the majority of the population in the world is living in nuclear families. So families where there is a mother, a father, or two same-sex partners, and a child or children, or more than one children. So when a family is structured like that, there is a need for care for children, or for care for older parents living in other households. Therefore, we really need to act and fast. Then let's now talk about, very briefly, about the relationship between paid care work and unpaid care work and paid work. So this circle is a bit the conceptual framework of the report, and is basically saying very simply that the levels and distribution of unpaid care work have influenced the way in which the persons who are shouldering this work are entering the labor market. So unpaid care work is usually carried out by women, and it is a barrier for them to progress in the labor market. But on the other hand, the historical underevaluation of unpaid care work has led also an historical underevaluation of paid care work, because paid care work, especially the work carried out by domestic workers, is often seen as an extension of the work that each of us does at home, and often is not remunerated properly. Just to give you very few facts about unpaid care work, 3 facts that are very important. So across the world, women perform 76.2% of the total daily time spent in unpaid care work, which is equivalent to 4 hours and 25 minutes per day, while men spend only 1 hour and 23 minutes in the same activity. But the interesting is that when we sum the paid work and the unpaid care work for women, we see that women spend higher time working than men. So they have longer working days than men. And you can imagine that this situation is further exacerbated for domestic workers. We don't have this data available, but we know that domestic workers spend more time working. They have longer working days when compared to other care workers, because many times they live in the household of their employer, or they have to travel from one household to the other. Therefore, this situation is very dramatic, and it has also reflections for the working conditions of domestic workers. Then, second facts about unpaid care work. Unpaid care work is the main reason why women are outside the labor force, and 41.6% of women are inactive due to unpaid care work. And this compares to just 5.8% of men who are inactive due to unpaid care work. So this is alarming, and it's showing how actually unpaid care work is keeping women outside the labor force. Why? Because there are not enough care services, and it's often not profitable for women to externalize the care and to join the labor market, because the remuneration that they can get in the labor market is not enough to cover care, paid care services. Then we have also to say that the third fact, that the amount of unpaid care work is exacerbated and is increased with motherhood, that is associated with labor market penalties in terms of employment, leadership, and pay. I mean, I have said there are unpaid care work is actually creating a burden, especially for mothers. But there is a survey that asked about the preferred work-family arrangements in 45 countries. This is the International Social Survey Program. So the reason why unpaid care work is still a burden for women, and I mean, it's not the main reason, but it's one of the main reasons, is also gender stereotype. Because when we asked about the preferred care arrangements, we see that the mother at home and father full-time is still preferred by 37% of the respondents. And this is kind of worrisome, because it's actually, we need to change it, because otherwise the unequal distribution of unpaid care work that then spills over to the poor working conditions of care worker, including especially domestic worker, will not change, because everything starts from the house and from unpaid care work. Then this brings us to back to the other definitions that were explained by me and Claire, and this chart shows the level of care employment across the world. And we know that across the world there are 381 million care workers that represent almost 12% of total employment. And when we look at the domestic workers, we have that are defined as those employed by household. So we used the statistical definition in the report. We found that there are 70 million domestic workers, and that represent around 2.1% of total employment. But of these 70 million, around 70% or 49 million are women. This percentage, the share of domestic worker in total employment varies a lot across regions, and is highest for women in the Arab states. In the Arab states, 21% of female employment is found in domestic work, which is kind of a striking percentage. So we have carried out several analyses to find the reason of the regarding the varying share of domestic worker in total employment. So what this chart is showing? This chart is showing like a cloud of dots. Why a cloud of dots? A cloud of dots because there is no relationship between domestic worker and GDP per capita. I mean, we have tried to challenge the assumption that domestic workers are mainly in poor countries or are mainly in rich countries. I mean, domestic workers are often in countries where are more prevalent in countries where there is a lack of care services, because as you can see, there are countries with very high GDP per capita and with very low share of domestic workers in total employment, like Norway, for instance. There are countries like Kuwait with a very high share of domestic workers in total employment and very high GDP per capita. Then we have also looked very briefly at the relationship between domestic work and income inequality. And actually here we see a relationship. So the share of domestic work in total employment is actually, I wouldn't say perfectly, but very well correlated with income inequality in a given country. For this purpose, income inequality was measured using the Gini index, which is a coefficient used to measure income inequality. Well, this is not very surprising, because having a domestic worker at home, it means that an household has to have the necessary amount of resources to pay a wage. So it means that this household has earn some wages and then can pay another wage to a person taking care of the family. But this is also often the case is that there are often households who might not afford, who don't want to pay a decent wage to domestic worker, who do not want to keep the domestic worker with the formal registered contract, pay social security contribution. And this is why, I mean, the next slide brings us to the informality rates of domestic workers. So, we have compared the informality rate of domestic workers with the informality rates of other wage workers. And I mean, I'm not even telling you the proportions because they are all very high, and we can see that depending on the country, women might have a higher likelihood of being informal than men domestic worker, but this is not the case. The pattern is not super clear, but it's clear that domestic workers have higher informality rates, very high informality rates when compared to other care workers. Sorry, to other workers, not other care workers. Then, just to why this is the case? Well, I mean, domestic workers, as was also said by Claire in her introduction, they often work in the privacy of the home, and they lack effective protection and often face discriminatory social norms. So they have, and this is why we have Convention 189. Domestic workers often don't have the necessary legal protection, and this, of course, translates then in further discrimination when we analyze the informality rates of domestic workers. But also, even where they have the necessary legal protection, they often face violence and harassment in the forms of verbal abuse, which is the most common, but also physical, psychological, and sexual violence. As I was saying, as we have just seen, domestic workers are often informal, so they lack the social protection, and this is very relevant for mothers. Because mothers, domestic workers are often not covered by maternity leave, and there are also the 30% of domestic workers across the world are not even covered by maternity leave by laws. Not because then there is a law, then we turn to the practice, and they might be informal because the employer is abusive. But then there are certain countries where actually the law even is not requiring the employers to insure domestic workers in Social Security Institute. Therefore, one of the potential, one of the best, I would say, not potential way forward is for countries to ratify Convention 189 and also take into consideration the accompanying recommendation, which lays down the basic rights and principle to protect domestic workers. We have reached the end of the presentation, and I would like to end now the floor to Emanuela Pozzan, if Claire allows me. Emanuela Pozzan will now give you a very good overview of the policies that can be put in place to help domestic workers and in general all workers with care responsibility. But we have seen that when domestic workers have care responsibilities, it's actually more difficult for them because they work very long hours. Thank you very much.
I have a question for Umberto. Can I go back to the graph? I saw some inequality. Can you explain, for example, can you pick one or two countries to explain further?
Sorry, I was on mute. Yes.
Yeah, there was a presentation, some graphics showing the inequality of the country and the relationship to the domestic workers. Can you pick one or two countries to explain more? Because I was not familiar with this graphic.
Yes, so basically you see the graph, yes. Mm-hmm. No? Yes, so let's take Saudi Arabia. So it means, Gini index, it's a coefficient that the bigger it is the value, the bigger is the income inequality. It means that, to explain it very simply, it means that, for instance, in Saudi Arabia, we have a value of around 45%.
That is high.
Yeah, it's high Gini coefficient. It means that the wealth of the countries, the income is earned by few people. And basically, the majority of income is earned by few people, and the remaining part of the population earns just a smaller amount of income. So it means that there is actually very high level of income inequality. Why it correlates with domestic workers as a percentage of total employment? Because if the only few people earn a lot of income, it means that they can hire domestic worker for carry out care work. I mean, there is a big difference in earning between the middle class and those who are in the lower end of the wage distribution. So it means that those in the middle class can easily hire domestic workers for carrying out, for fulfilling basically their care needs, no? Because there are not many care services also in the countries where there is very high income inequality, because the role of the state, that usually the state has, of redistributing income through taxation and through social security contribution, is marginal. Basically, there is no welfare state. It's actually what also Emanuela was saying, that when the welfare state is not generous, care policies are not there, and to fill these gaps, often families are more likely and are tempted to hire domestic workers. But the case is that often the conditions under which domestic workers are hired are not optimal, and we have seen that actually they are not very good.
And the blue line shows the higher Gini index, higher percentage.
Yeah. So the blue line is simply, so this is like, you need to read it like a very simple equation. So this is the, I'm gonna pick, you see now my arrow, this is the domestic workers as a percentage of total employment is the dependent variable. So we have in this chart seen this as depending on the level of inequality of the country, so on the Gini index. The blue line is a regression line that you obtain when you use domestic worker as a percentage of total employment as your dependent variable, and the Gini index as your explanatory variable. We have also put here R squared, which is the goodness of fit of the regression line, and it goes from 0, when there is actually no relationship, to 1. I mean, a value of 0.4 is a very high value. It means that the domestic work, the percentage of domestic workers in total employment is highly explained by the level of inequality in a given country.
Thank you.